Good afternoon, everyone. Happy weekend. I'm sure you are enjoying your weekend, and most importantly, you are taking care of yourself, making your health and wellness priority. Welcome to a fresh episode of Health Focus Nigeria, your one stop health and wellness enlightenment program. Last week, the program couldn't come up because of the nation's 62nd independence anniversary, and we pray that the country gets better and the citizens and leadership are more patriotic. My name is Catherine Adunola Abimbola, your regular anchor and producer of the program. As you already know, Health Focus comes up every Saturday morning at 11:30 on Citizen FM 93.7 Abuja. You can join us live every Saturday morning on Citizen FM 93.7 Abuja. The link to the station at that time is in the comment section. We will appreciate you to join us live. And for all your engagements, for all your comments, your observations, and your questions, engage us on our social media platforms. Follow us on Twitter at healthfocusngr. Email us to healthfocusniger@gmail.com. You can send your short messages to our WhatsApp 07040282777. And our Facebook page is Health Focus Nigeria. Subscribe to our YouTube channel, which is also Health Focus Nigeria. The link to subscribe to our YouTube channel is also in the comment section. Let me take our social media platforms handles again. Follow us on Twitter at Health Focus NGR. WhatsApp is 07040282777. Send us an email to healthfocusniger@gmail.com. Follow us on Facebook, which is Health Focus Nigeria. Subscribe to our YouTube channel with the link in the comment section, which is also Health Focus Nigeria. Once again, my name is Catherine Adunola Abimbola, your regular anchor and producer of the program. Please share this broadcast. We'll be glad you share it so that it can reach to everyone. We need to get informed about some things. Do you really know that a poorly treated sore throat can lead to heart disease? It is alarming to know. So this morning on the program, we discussed with a cardiologist, consultant cardiologist actually, with the National Hospital, Dr. Oladipupo Fasan, and he gave us some insights of heart diseases or heart-related diseases or cardiovascular diseases, and there are so many intriguing information that personally I was alarmed. And before we listen to what Dr. Fasan said, the part of what he said actually this morning, let me give you an overview of what cardiovascular or otherwise called heart disease is about. From medical research, it is a type of disease that affects the heart or blood vessels. The risk of heart disease may be increased by smoking, high blood pressure, high cholesterol, unhealthy diet, lack of exercise, and obesity. Now, let us listen to more explanation by Dr. Oladipupo Fasan, consultant cardiologist with the National Hospital, on what we need to know about heart-related diseases.
In this part of the world, the commonest causes of heart problems are high blood pressure, number one, and then what we call valvular heart disease, rheumatic valvular disease, which is an infection, and it happens from something as basic as sore throat that is not well treated by parents, and over years that process can damage the valve of the heart, and eventually by the time the child is in the 20s or thereabouts, the heart is enlarged and it fails. And the third one is a condition we call cardiomyopathy. For this one, mostly we don't know the reason for a number of people, but for a few people we have certain situations that can be associated. For instance, pregnancy can be a cause of heart disease, peripartum cardiomyopathy, and so many other conditions, HIV, some hormonal problems, hyperthyroidism and other things can damage the heart. So in Nigeria, the topmost cause of heart disease is high blood pressure, hypertension.
Okay, doctor, you mentioned something earlier that if sore throat wasn't properly treated, can lead to heart disease. How? Sore throat.
Yeah.
How?
It's a big problem. In fact, Nigeria was like the capital of the world when it comes to that kind of problem. But good enough, it looks like the evidence we are having is that it is reducing gradually. If I were talking about heart problems like 30 years ago, for instance, 20 years ago, that condition would be number one cause in Nigeria.
Really?
But now it has dropped to number two. Hypertension has taken over. And I think it's probably because of lifestyle exposures. Even though Nigerians are poor, but generally there is better well-being than, let's say, 50 years ago, 40 years ago. Basically what happens is that the child gets infected and develops a sore throat. There are many causes of sore throat. We have viral causes, bacterial causes. So one of the bacterial causes is an organism called streptococcus. When the organism is the cause of that sore throat, if it's not well taken care of, the organism can get into the blood and eventually go and settle down on the heart valve. And when it settles down on the heart valve, means the heart valve is kind of now getting infected too, even though the primary problem was the sore throat. So in the process, the body tries to fight it. And the valves in the heart are very fragile structures. So when there is this fight between the body's defense system, the immune system, and that organism, usually they say that when two elephants fight, what happens?
It's the grass that will suffer.
So that valve where the fight is taking place gets damaged. Now the problem is when the damage starts, it starts slowly. In a few people, it starts rapidly, childhood age, between 5, 10, up to 15. But in most people, it is a smoldering, lingering fight. So by the time they are like 20s and 30s, in fact before 30 most times, they can't breathe again.
Wow.
And they try to do any little activity. In school, they can't play with the other kids. They can't run around. They try to do it, they are breathless, so they go to the hospital. And if they meet the cardiologist, we will scan their heart and we'll see the valve. Prior to now, it was one of the commonest causes of people going abroad for valve surgery. But the good thing is that these things are done in Nigeria now, done by Nigerian doctors on regular basis. Prevention is always better than cure, but if it does happen to detect it in time. The good thing also is that a number of the surgeries done in Nigeria are even partly sponsored by different foundations, so they are even far cheaper now than they could have been. Back in the day, there were all sorts of practice. You have surgery. Some people will say, go and lick palm oil and gargle with hot water. All sorts of things. All those practices did not help. Somewhat seems to be getting better. Some level of hygiene around us. So those infections are slowing down, and people have easy access to medical professionals. If they do present, they get treated.
That being said, some people will say, they say there's too much fat in your heart. How can you explain that? And how does heart-related issue present? What are the signs? What are the symptoms that you will see?
Let me say first that these conditions we call cardiovascular disease, prevention is always better than cure. So what we want is not to have it in the first instance. Okay, so when people do have it, the heart conditions, people present in different ways. It could be a slowly progressive one, and sometimes it's sudden. So for instance, you hear that someone is just start standing by somewhere or talking somewhere and slumps and dies. That is a sudden one. It could be a cardiac arrest. It could be a heart attack that leads to a cardiac arrest. That's sudden. Even though a number of times, that one too is a culmination of certain processes. But in a few cases, no previous clinical feature. It just happens, and that is it, unfortunately. But in most cases, there is a process that leads to it eventually. And then when it does happen, the presentations are of different types. Some people can have shortness of breath. In that case, they are probably going to develop heart failure, or they are already in heart failure. Some people could have chest pain when they do exercise or when they do activity. In that case, they are prone to having a heart attack, and they also need to see a doctor quickly. So people present in different forms. However, the important thing is that prevention better than cure. So right now, 1/3 of adult Nigerians above 18 are hypertensive. The recent research showed that roughly 33% of Nigerians on the average, in some parts of Nigeria, especially in some northern parts of Nigeria, as high as 40-something%. Now, in terms of that fat in the blood, people get it wrong often. Even though it's a form of fat, they are called lipids. Lipids are like cholesterol, actually. So someone can be slim and yet have high cholesterol. Someone can be fat and have normal cholesterol. Cholesterol in itself is not totally bad. We need it for many things in our body. For instance, the hormones that we have as male hormones or as female hormones, the backbone, the chemical structure that leads to the formation of those hormones by the body is from this cholesterol. The membranes of all our cells, our brain cells and all the other cells in the body, they are covered by this cholesterol. We need them for many things. The problem is when it is in excess for a prolonged period, then you are at risk of having a heart attack or a stroke or some other condition. Now, what that cholesterol does is to cause a reaction inside the vessel wall, the arteries, the vessels that supply blood to different parts of our body, and cause a narrowing of that artery. It's like having a drainage and you put a blockage. When that happens, suddenly water cannot flow through, and as it's narrowing down, initial symptoms will be pain when people do exercises, but sometimes it blocks totally. And if that happens in the heart, it's heart attack. If that happens in the brain, it's a stroke. If it happens in the kidney, in the artery that supplies the kidney, that kidney is gone. If it happens in the eye, people go blind. If it happens anywhere. If it happens in the digits, if care is not taken, it should be amputated, because that limb will go gangrenous. So it can happen anywhere. Most people who are on the big side, they don't often exercise. If you don't exercise, you are not going to be physically fit. The point is, when you are not physically fit and you go and do unaccustomed activity, you go and climb 2 flights of stairs or something, you'll be out of breath. However, it doesn't mean there are no issues sometimes. So I'll give an example. People who are on the big side have a tendency of becoming hypertensive and having obstructive sleep apnea when they snore excessively during sleep, to the point that sometimes they even stop breathing when they are sleeping for a transient period, and that can happen many times in the night. That process, coupled with the high blood pressure, can predispose them to having enlarged heart. And if the heart is enlarged, it can fail. If the heart fails, if they walk a little distance, they can't breathe. If they bend down to do anything, we call it bendopnea actually, to tie the shoelace or do something and they get up, they can't breathe. It's a big problem. It's a huge problem. Now, another risk factor that will come because of that body size is what we call DVT. Deep venous thrombosis. A clot can form in the veins of the legs or some part of the body, and it can gradually flow to the heart. And if it goes to the heart, what we call pulmonary embolism, it can be a problem, and it can be a source of shortness of breath. And this is seen also in people who are on the big side. So, and don't forget that, of course, people on the big side tend to have arthritis as well. They walk a little distance, they are in pain, they are discomforted and all that. So there are many factors.
What is the relationship between stroke and cardiac arrest?
There are 2 different things, really, but they can sometimes occur in consonance because there's a sudden blockage or a burst in the vessel that supplies blood to a portion of the brain. And once that happens, that portion of the brain that artery is supposed to supply starts dying. If proper care is not taken, the patient might die. But cardiac arrest in itself is the end product of many things. Basically, cardiac arrest is a condition that makes the heart stop, and whatever is causing it to stop is traceable to a condition within 1 hour of it happening. So, for instance, someone can have a very big heart and he can't move, he can't walk, he's breathless, can't even sit down. They're always standing up or leaning over to be able to breathe. If nothing is done and the patient is not well taken care of, that heart is a heart that can develop irregular beats. And when it develops irregular beats, it can develop what we call ventricular fibrillation, which is cardiac arrest. I'll always give this example. If you have a car that the engine is smoking and is shorting oil and it's not firing as well, that engine is still working. It's not working optimally. That is like heart failure. Heart failure is just an ability of the heart to meet up with the body's metabolic demands, to pump enough blood to meet up. So your demand when you are walking on a level floor is different from your demand when you are climbing stairs. It's different from your demand when you are jogging. If the heart cannot meet up with these extra demands, the heart has failed. But even though it's still working because you are still alive. But in cardiac arrest, the heart has stopped working completely. So it's like having an engine that knocks back and the engine is not working again. It stops. One can lead to the other. So when the engine is shorting oil, smoking, not working well, it's already showing you it's going to knock. So if you have heart problems and you don't take care of them, it will lead to cardiac arrest one day, and that's death. So most people that end up dying from cardiovascular problem actually die from cardiac arrest because the heart will eventually just stop working one day.
Aside from all that you have said, what are the things that makes the heart to be stressed?
We are talking about risk factors for cardiovascular diseases.
Yes.
These risk factors, there is a way we discuss them. There are some we cannot help, but most of the other ones we can help. Let me just say 1 or 2 of the ones we cannot help. Okay. For instance, age is the most constant factor. The older we get, everybody prays to get old, but the older we get, there are chances that we'll have some cardiovascular issues. Hypertension gets more as we get older. You can't help it. Apart from that, coming from a family that has tendency to have high blood pressure, for instance. But the ones that are quite important, germane, and we can work on are these ones that have to do with lifestyle. I've mentioned some of them: high blood pressure, high cholesterol, diabetes, obesity, sedentary lifestyle, poor dietary habits, eating a lot of salt, drinking too much alcohol, taking cigarettes, not resting well, eating too much oily food, too much red meat. All these factors come together, and over a medium to long term period, they end up causing problems for people. So for instance, when people drink excessively, they have a high risk of having hypertension, stroke, diabetes. What I tell people with my family members, when you say one thing will kill a man, if it keeps you straight, you are gone. The people you left behind will cry. Okay, but we also move on along the line. But what if it doesn't kill you straight? What if it maims you? For instance, if someone has a stroke and one half of the body is useless and you are not dead and you can't walk, do you know this kind of suffering it gives people? Not just suffering in terms of psychological, social, but economic problem. Because if you are the breadwinner of the family, your family is in trouble from then on. I mean, children's school fees and all that. We know what Nigeria is saying now. So those are the things we talk about, So those risk factors, like I mentioned, the ones we can help, hypertension, diabetes, obesity, we can do a lot to really help.
You mentioned red meat, and I'm happy you did. Please, Dr. Fasan, you are a consultant cardiologist. Which meat is not red? Please. That is one. Two, some people will say, don't eat this Titus fish. It's too full of cholesterol.
That is actually the best fish.
So please give explanation to
when
these
we
two
talk
instances.
about red meat, nobody is against beef or people who...
Or fowls, they call orishirishi.
Yes. The thing is, in the formation of cholesterol, most of the cholesterol in our body is actually our cells that produce it. The ones we eat directly are mostly from things like egg or offals. But they constitute just about 15 to 20% of the cholesterol in our body at any time. The remaining 75 to 80%, we produce it ourselves. So the question is, where do we produce them from? How do we produce them? The liver actually produces them. Liver produces them. The building blocks of that is fat. But what type of fat? It is what we call saturated fat. Where is it from? It is from animal products. So which animal products? That is where the issue is. So that saturated fat, which the liver uses to produce cholesterol, is from animal fat. And which animal? That's why we say red meat. So you see people say, I love tozo. The sweetest things are the things that kill.
Wow.
So those parts of animals that have a lot of fat, that fat is animal fat, and it contains saturated fat. And that is the fat the liver uses to make cholesterol. So that's why we say, cut down.
No more tozo.
When you talk about white meat, it's a figurative speech, really. I mean, fish is largely white meat. Chicken, too, is largely white meat.
Say chicken without the skin.
Yes, because there is some cholesterol still in the skin, some fat as well in the skin. But the white part of the chicken, the muzzle itself, even mostly the breast of the chicken is quite muscular and it is less fat. Then fish. Now, in terms of the fish, we talk about oily fishes. That is what we want, really. Fish that is oily, because the oil in fish contains omega-3 fatty acid, which is a form of monounsaturated fatty acid. I said earlier that the one in red meat is saturated fat, which is what the liver uses to make cholesterol. But the unsaturated fat is the good one. The liver does not make cholesterol from unsaturated fat. So that is why we advise that people should take, if they have to take fat at all, it should be unsaturated. Now, in terms of protein, the oil in the fish is unsaturated. And Titus fish in Nigeria, the commonest fish is Titus that has good oil content. That is good for health. There are other ones, but Titus is good. Now, if you are abroad, or for those that have money, salmon, tuna, all those things. But for regular people, Titus. Tilapia is also good, because these are the bony fishes and skin fishes.
Thursday was World Heart Day. Now, Doc, as a leading member of the Nigerian Cardiac Society, how do you assess Nigerians' acceptability of regular checks of their heart in tandem with World Heart Day?
Okay, the theme for this year's World Heart Day is use heart for every heart. And in essence, what we're saying is that take care of every heart around you. You need to go to the parks on any day in Abuja, work day in the evening, and on weekends. You will see thousands of people doing one form of physical activity or the other. So it means it is not totally woeful story. It means some of the programs like this have been entering into some people's minds and they are practicing it. I'm impressed.
You'll agree with me. That was extensive and very germane information. Thursday 29th actually was World Art Day. 29th September was World Art Day. And I was blown away this morning when Dr. Fasan said poorly treated, sore throat can lead to heart disease. Please, 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 I'm begging you, let us take very good care of ourselves. Don't let us resort to self-treatment, self-medication, as it were. Let us go to qualified medical facility to check ourselves, know the medications to use. We cannot just assume that because Abimbola has taken a particular medicine for sore throat, it will also work for somebody else. It doesn't work like that. That is why tests are done. So I beg of you, for anything that is happening in your body system, when there are changes you don't understand, let us go to hospital. Let us see qualified medical personnel, qualified medical facility, not just I want to be a doctor on the roadside. Let us go to medical facility that are qualified. And now, some of us don't know, some of us do know that Titus fish is the best to assist us in our cholesterol. Titus fish. And for some of us in the Abuja resident, no more tozo cancel, no more. Nobody should eat tozo again. It is forbidden. It damages the body system. So this is how far we will go on today's episode of Health Focus Nigeria. I'm sure those information that Dr. Fasan gave, we are going to internalize it. We are going to make use of it. So I beg of you, share this broadcast to everyone that you know. Share it and engage us on all our social media platforms. Follow us on Twitter at Health Focus NGR. Follow us on Facebook, Health Focus Nigeria. Subscribe to our YouTube channel, which is also Health Focus Nigeria. The link to subscribe to our YouTube channel is in the comment section. Email us to healthfocusnigeria@gmail.com. Send us short messages on our WhatsApp, which is 07040282777. I'll take that again, please. Our email is healthfocusnigeria@gmail.com. WhatsApp is 07040282777. Follow us on Twitter, which is at healthfocusngr. Twitter is at healthfocusngr. And subscribe to our YouTube channel, which is Health Focus Nigeria. Follow us on Facebook, which is Health Focus Nigeria. Until next week, when we come with another topical medical issue. My name is Catherine Adunola Abimbola, your regular anchor and producer of the program, saying, please do take care of yourself. No more fatty meat, no alcohol, no smoking. Let's take care of ourselves and let us be healthy. Bye for now. Thank you for watching.